Ah, the place of miracles, loss, sadness, and how are you alive right now? The pediatric intensive care unit. Two in 10 kids end up in peds ICU each year from car accident, house fire, a failed attempted to not even exist, and infections and chemo treatment-related cancer problems that rarely, but sometimes happen. 27% of kids, teens, preteens, toddlers get to go home as miracles of beating the peds ICU. But 5 to 10 patients die in picu. So a nurse prepares the kid for parents to say their goodbyes to their son, daughter. To prepare, they dress kid up and give the bad news to the family, who might be angry, sad, histrionically upset, or just quiet, still. PICU nurses can give bad or good news updates to a family. They give baths, brush hair, and monitor oxygen, pulse, and blood pressure. They manage machines and sometimes witness a true miracle and help parents by comforting them or helping them grieve the loss. And they comfort kids who are upset, mad, angry, or scared. But deal with parents who are angry, upset about the loss, and are in denial that their baby boy or girl is dead. Nurses get secondary grief trauma and witness lives ended too short, and burn out, and the compassion becomes tiring. It's a high-staked job, and needing multiple staff to do treatments or meds. 495% of PICU doctors are female. 881% of PICU doctors are men. Both get paid $343,367 hourly, $30 to $289, just to deal with downsides of traumatic cases, moral distress, stress, intense families, watching kids suffer, die, having to call time of death, then document it. The shifts are traumatic, grueling. You burn out faster. Small clinics have no peds ICU. Your payment is disparities, and you work 24/7. But as a PICU doctor, you get to have challenge, collab. Your job is high demanding. You get to see miracles. CPR interventions, you get to be the leader. Manage advanced tech. Get to diagnose, treat, do an intubation, central lines. Give good or bad news. 100% of peds patients in PICU have drug infusions when they get wheeled in or flown in. 100 to 1% of peds patients have TPN, IV meds, fluids, saline bags when admitted to the peds ICU. 6% of patients in peds ICU are on dialysis for chronic kidney disease or an accidental overdose. 5% of peds patients in ICU are on heart-lung bypass machine while they find a new heart-lung in an emergency. 1 in 3 kids in peds ICU are on ECMO, external membrane oxygenator, for diabetic acidosis, or house fire, car wreck, or an infection that's shutting down organs. 4,000 peds patients have a tracheostomy, where they place a tube past your nose, throat, vocal cords, and stomach to reach your trachea. Then they put a tube there and tape it down to your throat. 25% of patients in the PEDS ICU have a feeding tube during their stay because of surgery, car accident, house fire, abuse, or anything traumatic. You cannot bring hairdryer, heating pad, outside foods, drinks, anything strongly odored, large amounts of cash, drugs, alcohol, vaping wands. But can bring something fun and front-buttoned PJs, stuffed animals, blankets, books, phone chargers that are long, and your phone and a tablet so the kid can speak, laugh to your jokes.